In her report to the United Nations General Assembly, the UN Special Rapporteur on the Right to Health proclaimed, the right to health cannot be realized in a racist world. Through this statement, what the rapporteur was doing was reminding us all of the biases and abuses faced by minoritized people across the globe. The predominant concept of global health evolved as a humanitarian rescue mission to the global south by philanthropists, charitable organizations, and public health experts from global north. Indigenous people, as well as people of African descent, Roma, and other ethnic minorities, experience stigma, racism, and racial discrimination. This situation, according to WHO, often increases their exposure and vulnerability to risk factors and reduces their access to quality health services.
To me, racism has to do with historical colonialism, structural inequalities, and the way we see each other and the otherhood. Therefore, the opportunity to improving the well-being and health of children and adolescents in our region and in the world has to do with recognizing and preventing racism to every person, especially children.
Racism meant that children such as me were not fortunate to be born white. From the time they took their first breath, their potential was already limited. Apartheid, as a formal policy, was abolished almost 30 years ago, but we live with its legacy to this day. Children from formerly discriminated groups are not able to live life to the full in terms of their health and well-being, whether these are defined in narrow or broad terms.
Racism is the ideology, it is the belief system that supports the ongoing coloniality that we experience here in New Zealand, but that which many Indigenous peoples are experiencing around the world. Racism operates to sever the ties, to sever the relationships that are created around a child and a young person and that are critical for them to be healthy and well. And those relationships exist at multiple levels. So when we see information that talks about Indigenous children being uplifted or removed from their families and put into state care, we have to remember the important relationships that are being severed between a child and their family, which all of the information and literature tells us is critical for lifelong well-being.
I'd say that racism in child is one of the strong drivers of inequalities because it not only puts you in a differential position to achieve the same than others, but also it makes your life much difficult and harder. Let alone child health outcomes. We know that First Nations people have worse health profiles than non-health people. Unfortunately, this data is not systematically collected.
I remember walking on the beachfront with my daughter and realizing that we were walking on sands that a couple of decades ago were not allowed to tread. You see, I was born in South Africa, a country in which it was illegal not to be racist. Nowadays, people talk about apartheid in different contexts, but it was here in South Africa where this racist system was created and perfected. The discriminatory policies it informed determined the sort of education, health, and other services people were allowed to access based on their race. The beach on which I was walking would have had a sign that read, "Net blancos," or whites only.
As the 2022 Lancet series on racism, xenophobia, and discrimination pointed out, COVID-19 uncovered social and political fractures within communities with racialized and discriminatory responses to fear disproportionately affecting marginalized groups. Political leaders have misappropriated the COVID-19 crisis to reinforce racial discrimination, doubling down, for example, on border policies and conflating public health interventions with anti-migrant rhetoric. Many of these realities, these patterns of discrimination and bigotry, were always there. What COVID did was expose them and laid them bare for everybody to see.
We also have to remember that those state institutions are themselves places of harm and places of ill health for Indigenous children and young people. And so that is an important element of how racism impacts child and youth wellbeing. Similarly, when we see media reports or academic articles that talk about the hyper-incarceration of Indigenous women in prisons, then we have to remember the evidence that tells us how critical the mother-child relationship is for child health now, but also for lifelong health and well-being. I see those impacts as a breach of a child's right to health, but also as a breach of an Indigenous children's right to be free from discrimination and to live freely as Indigenous peoples on our own land.
I was born in Peru, and Peru has had hundreds of years of colonization, and people have different ancestry, different languages, yet the value, well, the perceived value of people across the entire country is not the same. For example, teaching people and teaching the entire nation in Spanish, whereas for some and for many people not living in cities and not living in urban areas, that's not their native language. So you grow in that environment where you are trained, or you go through an education system that doesn't recognize your language. You grow in an environment with less opportunities. Socially, you receive less chances as well, and working in your productive environment that you have less options as well. So in summary, the experience of racism is sort of this intergenerational, but also long-term, across the lifespan, long-term sort of chip that goes into your brain, that you're different and actually that you're inferior. And that's growing with that burden. I wouldn't wish that for anybody.
The tide against apartheid turned when the world stopped propping it up directly and indirectly, and its continued existence became an unsustainable burden to its architects and proponents. It is thus my hope that this commission will contribute to creating an environment in which it is not possible for the world to ignore the harm and damage that racism and discrimination does to people's well-being, in particular to the health of developing children, taking away their potential even before they knew they had it. It is my hope that the Commission will catalyze the emergence of such an environment that gives people the courage to see, but even more importantly, the courage to respond appropriately to creating a world in which each child is allowed to thrive, irrespective of the color of their skin.
So I'm hoping that this Lancet Commission on Racism and Child Health helps us all to remember how racism supports a range of different oppressive systems that limit the lives and cause harm to the health and well-being of children and young people across the globe. And finally, I think about the way that racism operates to sever the ties that Indigenous children and young people have to our own knowledge systems, be they scholarly knowledge systems, language knowledge systems, cultural practices, and other systems that have for centuries supported and nourished all Indigenous peoples to be well. And so again, I think this is a really important opportunity for the Lancet Commission on Racism and Health for Children and Young People to really help lift our gaze, not just on the ways in which racism causes harm to children in terms of physical and mental health, and they are really important issues for us to consider, but also the other types of harms that are created in relation to social cohesion, in relation to familial and community relationships, but also in relation to the rights of Indigenous children to access and practice and celebrate the knowledge in the languages, in the ways of knowing and being that are unique to us and part of our holistic way of thinking about health. I think that rights-based social justice perspective is something that the Lancet Commission on Racism and Child Health can bring to our existing scholarship, and that we can use to advocate for states to uphold and remember their responsibilities to ensure that all children and young people's rights are being upheld, and that all children and young people are supported to live full and healthy and flourishing lives.
What I wish from the Commission is to make visible these differentials. I think we, from the health sector, we are very much used to see differential in groups, but the pressure and the enormous, substantial negative influence of racism during childhood is devastating. So in a way, it affects our human capital, it affects our productivity, it affects everything that we strive in society. It is morally wrong. And what I expect from this commission is to bring that voice loud, front and center, and also shake paradigms, shake people that those views are unacceptable in the world that we live today, particularly thinking on a planet with a sustainable future. What I would also like to see in this commission is bring closer the voice of the youth to tell us, because they have to live through in the future through that, and to why not imagine a different world with a different future.
The question that we need to be asking in 2023, why is this still not happening, and why these issues continue to mar the global health agenda? In a statement on the impact of racism on child and adolescent health, the American Academy of Pediatrics in 2019 noted that racism is a driver of health inequities, and that the failure to address racism will continue to undermine health equity for children, adolescent, emerging adults, and their families. Strategies to address health and development issues across pediatric lifespan that incorporates ethnicity, culture, and circumstances are critical to achieving a reduction in health disparities. The paternalistic origin of global health has fostered power structure and culture of supremacy that considers prior consultations with the beneficiaries unnecessary before decisions are made on the health interventions to offer, pointing to the imperative of involving Black people living in Africa in setting the priorities for global health research. Repeat calls are made to recognize racism and xenophobia as fundamental determinants of health, and to implement measures that focus on addressing the structural causes, however, with limited success. Time is now to take transformative action to address racism in global health. Thank you.